So your task is that a 15-year-old boy who has a
Mm-hmm.
cough came with cough for few days.
Cough.
For few days.
Mm-hmm.
So
Few
take the
days.
history. Uh, take focus history. Few days means his cough is worsening now. Now that's why mother here.
Okay.
You want time or you want to start?
Give me 1 minute.
Okay, okay, no problem.
Okay, we can start. Okay, good morning.
Good morning.
I'm Dr. Sarah, and one of the children doctor here in the hospital, an adolescent doctor. I believe I'm talking to. I can give any name.
Oh, suppose he is John and his mother is Sarah.
George,
John. The child is
John,
John.
Mother Sarah. Okay, I'm talking to Mrs. Sarah, Mother John.
Yes.
Mother John. Okay, nice to meet you, Mrs. Sarah.
Thank you.
Today, Mrs. Sarah, I will take some notes regarding John. I will write it down if you don't mind.
Yes, of course.
Okay. Mrs. Sarah, can you tell me what is your main concern regarding John today?
Doctor, what I tell you, my experience, I'm really exhausted. John again has this cough and it's become worse and now. I'm really tired of this his cough, his chest problem.
I'm so sorry for that. When this cough started?
Actually, his cough on and off in his whole life, but that is like 15 days back started, and now it not improving.
Okay. You notice what make this worse, this cough worse?
Actually, I have not noticed that much, but I think some dust, pollen, sometimes it make worse.
With that. Okay. Did you notice related to any time per day? I mean, increasing during morning or night or.
No, I don't think like that.
Mm. Also, you notice, is it increasing with this exercise or no?
No, nothing. I don't think exercise
Oh,
related with that.
okay. That cough is chesty or dry?
Sometimes it is chesty, sometimes it is dry.
Mm-hmm. When it is chesty, what is the color of that sputum?
No, normal color.
Normal color. Okay. And with this cough, he's feeling of this difficult of breathing. I mean, associated with difficult of breathing.
Yeah, when the cough become more worsening, then he feels difficult breathing. Otherwise, not.
Mm, okay. And okay. And what do for that cough? I mean, what you are giving for this cough?
Actually, he take his medicine, the syrups, and the antibiotic doctor has prescribed that I have given him.
Okay. Okay. Any change in his color with this cough? Turn to
No,
blue or become
no.
okay.
Last time it was blue, but this time actually never he gone blue.
Okay. Okay. And okay. This is you told this is recurrent, not this is the first time, but worsening last few days. Am I
Yes,
right?
yes, 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 doctor.
Uh, okay. Okay. And you have okay. You have any other concern, Mrs. Sarah?
This is his concern, and also I think if he's not growing well, but we talk with the GP. GP is telling that it is normal.
Okay. He's suffering from any long-lasting illness rather than income. So this
Yeah,
cough.
yeah. He is, he when he was 2 years age old, he is diagnosed with the primary ciliary dyskinesia. This one disease.
Ah, I'm so sorry for that. And you are following with which doctor?
We are following with the chest doctor.
With this doctor, okay. And what the treatment he's getting?
He is taking, some syrup and some antibiotics they tell us to give, and we give this.
Okay, I'm so sorry for that. Okay. Any fever with this cough?
Fever means sometimes low grade fever come.
Mm-hmm.
He's
You
taking
can
medicine. That's why.
on and off y-
Hmm?
that fever on and off.
Yeah, fever is on and off, low grade.
Uh, okay, okay. And you notice any change in his weight recently?
Weight, he's not that much look healthy. That for his this
Mm-hmm.
chronic disease. We are also taking the suggestion from the dietitian. They suggest us to take a healthy diet. He also takes some healthy extra nutritions.
Mm-hmm. Okay. And okay. And what about his appetite? Is it
He,
affected by this stuff?
yeah, actually, when people feeling sick, they are not having good appetite. He is also like that.
Okay. And sleep pattern change with this?
I don't get
I mean, this affect his sleep? This
sleep.
cough from
Yeah,
this?
yeah.
Yeah.
Last 2 days, he is just semi-sitting position sleeping.
I'm so sorry for that. Okay. He is okay. Complaining of any heart racing with this
Uh,
cough.
no, if
Mm.
chronically cough, vigorous cough, then sometime he told. Otherwise, not.
Okay. How many pillow he's using usually when he is sleeping?
Actually, normally one pillow, but last 2 days we are giving his back 2 pillows.
Okay. I'm so sorry for that. Okay. You notice any increase in his tummy size?
No,
Any tummy pain?
no,
What about his bowel habit? Any change?
no. There is no any change in bowel habit.
Mm. You notice any yellow discoloration in the white part of his eye?
No,
Okay. Any recently concerning is his urine? I mean
no,
amount, color,
no.
and okay. Anyone check his blood pressure?
Yeah, the GP when we go, he say regularly we go follow up. So GP
Mm.
measure, no problem.
Okay. Any headache? He is
Uh,
complaining?
Headache? No, no. There is
Yeah.
no any headache. No,
Abnormal movement or change in his mood
no, no,
recently?
no,
Okay. Any weakness in any part of his body?
no,
Have you noticed any preference in the weather, cold or hot?
no, no,
Okay. Any swelling in the front of his neck?
no,
Okay. Okay. Any joint pain or joint swelling?
no,
Skin rash or skin spots?
no, no.
Okay. Any pallor?
Pale for he is not eating properly. That's why maybe she looks very pale, weak. He is feeling.
Sorry. You mean weak and fatigue like that?
Yes, yes.
Okay, I'm so sorry for that. Rather than that, chest doctor and that dietitian, you are following with another team?
No, only chest doctor we are following.
Ah, okay. And you told he is on regular medication, that syrup and that antibiotics.
Yes, yes. When he affected, we have given him these medications.
Okay. He was admitted before, John?
Yeah, yeah. He has admitted before.
When is the last admission?
Actually, he admitted for this 2 years age old when he was. Then he was diagnosed with this
Diagnosed?
primary PCD, and after that 1 or 2 time he admitted for this cough. 2 or 3 days. Then he discharged.
He was not admitted to this high dependency unit.
When he was 2 years old, he admitted.
He admitted. Okay. And any recent blood test done for him?
Yeah, GP has done some blood test. They find infection
Mm-hmm. When this one? I mean, when the last one?
3 months back.
Three before 3 months back.
Mm.
Okay. Okay. You have any recent trouble, Mrs. Sarah?
No, no.
Okay, Mrs. Sarah, I will go with you back to his
9 minutes.
your pregnancy. Okay, okay. Um, okay, your pregnancy with him and after he delivered and after that, any concern you have rather than this? Any concern you have?
My pregnancy was uneventful. It was smooth. After
Mm-hmm.
delivery, the doctor discharged us and we go home.
Okay. He received all his shots?
Yeah, he has taken all the shots. Even doctor tell us to give extra shot. We also given that.
Okay, good. He start his puberty?
No, no, he is not started puberty. It's very slow. We are also concerned about that.
So sorry for that. Okay, and okay, he's allergic to any medicine
No, any medicine he is not allergic.
or any diet, any food.
Yeah, yeah. Sometimes he is allergic to pineapple, so we avoid him to give pineapple.
Okay. So he's allergic to pineapple. You have any emergency plan for that, or you have anything for that allergy?
No, no. For allergy, there is no any emergency plan.
Okay, I'm so sorry to ask that this teenager always trying to try something. So he is trying to take any alcohol or any drug.
No, I don't think he's taking. Actually, he has lots of friends.
Okay. He's okay. What about his development? I mean, he's going with his peers in talking,
Yes,
walking, and his
yes,
socialization.
yes, yes, yes. He is growing his
Uh,
peers.
uh, okay. Can you tell me about your family more, please?
Yeah, we are family. I have another child who is Mamun, his younger
Mm-hmm.
brother.
Okay. You have any chronic illness in your family or any just problem in your
No,
family?
no,
Uh, any similar condition like him in your family?
no,
Diabetes or thyroid problem in your family?
no, no.
Okay. What you are doing for living, Mrs. Sarah?
Yeah, I'm a school teacher. My husband is also a
Mm-hmm.
school teacher.
Okay. Your income satisfied for you?
Yes.
Okay. And this John, he's going to school.
Yeah, he is going to school.
What about his attendance?
Nowadays, it's low. Your time is over. Please present your case.
Oh, so I didn't finish. Okay. Today I took history from Mrs. Sarah, mother of John. He's 15 years old. She came concerning. He has cough. Uh, 15 days back, and this is increasing few days back. He is affecting his activity and his sleep and also his weight, and he is known case of primary serial dyskinesia diagnosed when he was 2 years, and he was admitted many times, one in this ICU, and he is on regular follow up with this pulmonologist, and he has yes, he has on and off on an antibiotic. The last culture done before 3 months, and he's not started his puberty yet. yet and of moderate socioeconomic status, and um, he is also allergic to peanut, but he have no any emergency plan for that one, and he's going to school, but he has some days off because of his illness. Between all this together, it is, I think, exacerbation
Yes,
uh, of this
primary
cystic
ciliary
fibrosis.
dyskinesia. What
Yeah,
is the
primary
DD?
care. Then
Differential diagnosis?
differential diagnosis also it could be um, you can also asthma exacerbation also, but yes, asthma, and also it could be also as immunodeficiency, but
Hmm.
uh, yeah, but I didn't
Okay.
ask about
So,
repeated chest infections.
so this is putting together all on a top diagnosis that is a primary ciliary dyskinesia. It's a recall history,
Yes,
it comes. And the DD we can keep like cystic fibrosis, bronchiectasis, Carter syndrome, immunodeficiency, and
yes,
bronchial asthma. These are the
okay,
DD we can keep for that. In exam,
okay.
how it comes? It comes like cough plus shortness of breath. Or otherwise,
Mm-hmm.
15-year-old boy with primary ciliary dyskinesia diagnosed with on age 2 years came with worsening of the cough few days ago. That is my history. Another history come like 14-year-old child with primary ciliary dyskinesia. There is situs ambiguous needed postnatal gut surgery for bilious vomiting and obstruction. First of all, your history was okay, but one thing I want to comment. Beginning, you are very good. At least you organized. But one thing you have missed some important point. Also, I think you are some little bit slow. First, in
Mm-hmm.
primary ciliary dyskinesia, what are the problem we search? There is repeated hair infections, sorry, ear infections, otitis media, hearing any
Yeah, I
aids.
didn't
Okay, you
ask.
need to
Yeah,
chronic sinusitis. There is nasal polyps,
yeah,
infertility, and
yeah,
puberty. You catch the puberty, but you have not asked any repeated ear infection or not. About hearing, vision,
yeah.
you need to ask. Another family history, positive presents. You ask any similar condition, yes, and there is hydrocephalus, head size, you need to ask. Dextrocardia, heart is other side. Uh, Present anything doctor mention you or not, you need to ask. And surgery is very, very important. You have not asked about surgery in past history because they have
Yeah, yeah.
tracheoesophageal fistula, esophageal atresia, biliary atresia, these are present. If you ask me, I will give you, because in exam it is a positive, it was present. The child has bilious vomiting and obstruction, gut surgery, postnatal.
I wrote, but I didn't ask. But how I can ask about this tachycardia, doctor?
Dr.
How
Kadia,
you
is
have?
anything, doctor, when you visited the GP done test, doctor told anything about his heart position, anything? Just we need to
Like
mention
that,
the
I will ask.
examiner that we know that is dextrocardia is associated with that.
Mm-hmm.
And also dextrocardia which differentiate us from Carter syndrome. Okay,
Okay.
we need to mention all this. So this is primary ciliary
Okay.
dyskinesia. First, it is associated with cough. Our chief complaint was cough. When cough, how we can analyze his cough complaint, onset, course, and duration. What make it better? What make it worse? So how long he is suffering? It's a chronic condition. We answered that. Both or together or not. If any associated, so diurnal variation, seasonal variant. We are excluding bronchial asthma. Is there any variations occur? Dry or wet? If wet, color, amount, odor of the sputum with specific positions. Cough become enough to cause vomiting, syncope, blue lips, cessation of breathing. So your cough analysis was very good. You ask about cough duration, it make it better, chesty, dry, wet, even in blue lip, loss of consciousness, ethnic history, anything present or not. These are
Mm.
just you have traveling history you missed, and then if they are chest, fever, weight, activity, sleep, you also tell us. Any nasal obstructions, how many pillows also you ask. I'm
Mm-hmm.
telling the system
This
in chest. Hmm. Any
okay.
unusual
This
sound?
nasal,
Hmm. Yes.
uh, this sinusitis and this nasal polyp, I will ask in the presenting illness
No, no. Sinusitis,
or.
you can ask. Is there any other concern? I can mention. Or
Mm,
during your CNS, when you tell headache, how about hearing,
mm,
how is the vision? These are. When hearing,
mm,
then I will
mm,
tell that, yes, doctor, there is a problem. He has repeated
mm,
ear infections.
mm-hmm.
Okay. or any repeated
mm,
infection, when you understand that a child has any chronic condition or not. I told you, yes, he's suffering primary ciliary
mm,
dyskinesia. Then we targeting that primary ciliary dyskinesia related all the questions. Uh,
mhm,
Already our DD 65 dose we exclude because of loose motions. We are telling
mm,
asthma not because it has not diurnal in variations, so it is going
mm,
PCD. So these are the
mm.
features. And head size you can ask about. Do you notice any change in his head size? Any VP, anything, any aids, supporting aid he's like in hearing aid, any shunt on his head? We need to ask this.
Mhm.
Okay, these are
Okay.
these are the positive finding. We'll search now about how can we manage. First of all, they will ask you primary ciliary dyskinesia. So first, I will assess his conditions. I will assess his vitals, heart rate, respiratory rate, blood pressures, any dehydrations, everything. I will checking his status. I will involve my multidisciplinary team, pulmonologist, my consultant, that admission needed or not. Then I will do if it is already diagnosed case. For diagnosis, what we do, we are
I
do
will
some
revise the
investigation for
previous notes.
saccharin test, bedside test for screening, and nasal exhale nitric oxide measurement, which is low in primary ciliary dyskinesia used in younger children 4 years age. So this will not applicable in our child. And
Mhm,
confirmatory is ciliary brush biopsy. That is a nasociliary brushing from the terminate and assist by. And then photometry, giving a beat frequency, electron microscopy will reveal ultrastructure abnormalities. So these are the multidisciplinary team. What we will involve? Pediatrician is the team leader. My physiotherapist. We will involve physiotherapist to regulate the physiotherapy of the chest. Dietitian we involve for right calorie diet. And treatment options are prophylactic antibiotic. We give bronchodilators, mucolytics agent, and for immunization, influenza vaccine we give, and education is compliant with the treatment. So he need to take the treatment, physiotherapy, he will take the antibiotic, mucolytic agent, dietitian he will involve. And these are the management patterns. And
हाँ
investigation, I
जी
tell you, diagnosis, saccharin test, and biopsy is the ciliary, brush biopsy is the confirmatory. Okay.
हाँ जी
okay.
Other lab we can do like
हम भी
full blood
फुल
count,
करेंगे
ESR, CRP, for our inflammatory marker. These are we check. And what advice we give? Some advice we will give the child, like avoid smoking and allergens, avoid
Mhm,
overcrowding, good aeration and housing, annual influenza vaccine, hearing regularly, um, that is monitoring and treatment of the bronchiectasis. So advice we are giving: avoid the smoking, allergens, avoid overcrowding, good aeration and housing, annual influenza vaccine he will take, and hearing monitoring. Okay.
mhm.
So this is
Here
about
for
all
me,
about my.
mm,
Yes.
uh, for me here because I didn't finish the time, so I should ask about the home and smoking also in the family. No?
Yes, smoking also you need to
Mm,
ask. Though one
yeah.
time I have told you that how it increase. I tell you that pollen dust, then it is increases, right?
Yeah. Okay.
One. So we need to know, and also you have not asked about diet history. Okay, nutrition history you missed.
Yeah,
Nutrition
nutrition. No,
history,
no, I wrote, but the time really, I afraid maybe I will not finish.
but nutrition
Okay,
history it
good.
is important.
It's
One time you
important,
ask
yeah.
about appetite on the present history, but another option,
Mm,
nutrition history, you need to nicely ask that how his diet, any dietitian he's following or not. Yes, if you ask me,
yeah.
then I will I already been informed that a GP doctor told us to dietitian because
ਇਹੀ
he's
ਪੈਂਟ ਪਾ
gaining weight,
ਜਾਂਦਾ
like that problem.
ਸ਼ਰਟ
So
ਕੋਈ
this is
ਇੱਥੇ
all
ਕਰ ਦੋ
about primary ciliary dyskinesia.
ਇਹ ਲੈ ਕੇ ਗਿਆ ਸੀ
I'm
ਮੇਰੀ
again telling the highlight point. What we start: otitis media, hearing aids, chronic
ਸਲਵਾਰ
sinusitis, nasal polyps, infertility, and puberty. And then we are present with bronchiectasis, chronic wet cough, sinusitis, nasal polyp, chronic suppurative otitis media, and GIT association. There is surgery present like tracheostomy fistula, esophageal atresia, biliary atresia. These are the surgery history positive present in CNS. If we search, we find hydrocephalus. So head size, we will ask, is there any VP shunt present or not? We ask because that is present. Male infertility. So we need to important ask the puberty, about dextrocardia, heart position. Is that heart is Doctor, tell anything about that heart and visceral situs inversus. These are positive finding we need to search. And smoking, allergy, these are also we need to ask in family history. It is an autosomal recessive conditions, so family history is positive. So this is all about primary ciliary dyskinesia. Thank you. Next history we are going.
Okay, thank you.